Hey guys, thanks for joining us with the Mental Health Coalition. We're just waiting for my sister Leah. She's going to be joining us soon, and we're going to talk about mental health and anything you guys want to hear. Hi.
Hi, Sarah.
Get out. I was working.
It's always like awkward when you're like first like join a live. You're like, hey, like waiting for everybody. Ooh.
Mental Health Coalition, but we're going to be talking about mental health.
I mean, that's what we're here to talk about. I feel like my phone is maybe a little, I don't know. I'm gonna put it down here. Hi, everybody. Welcome. I'm just letting people join.
Perfect.
I'm so happy you're doing this with me.
There's no one I'd rather talk about my mental
health. I mean, honestly, there really isn't anyone I talk to more than you about my mental health. Well,
I'm sure that's most of what we talk about.
Yeah. Wait, why am I getting a little like, what's your phone on? Because I feel like I'm getting a little.
It's on a computer.
Oh, is that? Oh, hi, Dana.
Yay.
Okay. My name's Leah McSweeney. You may know me from Roni. I'm also a designer. This is my sister, Sarah.
Hi.
And we are joining you from the Mental Health Coalition Instagram, which was founded by Kenneth Cole, who's a badass. And I'm just so grateful that we are being included to do this, because honestly, the more we have open conversations about mental health, the more that we can normalize it. I mean, I know that's kind of like a buzzword these days, but I feel like
I think talking about it is like the biggest medicine, and connecting about your mental health is the biggest medication like around.
Yeah, because then you don't feel alone.
Absolutely.
Right?
That's the power of like Me Too, you know?
Right.
Like, and there before, like someone relating their experience, even if it's completely different.
Yeah.
For me, that's what gets me through definitely like difficult periods with my mental health.
Yeah, I also feel like who isn't having like a mental health kind of crisis during the last year?
I think you have to be pretty
soulless
or like idiotic. No, I'm kidding.
I mean, honestly, let's
there might be a beauty in that, but that's just not how I function.
No, I mean, I don't know if I can say this, but I do think that smart people who are in touch with themselves do tend to have struggles with mental health, because we are in touch with what is going on, and we can't just like be living in you know.
And also live in a world that's just at a time where we can communicate with so many people. We actually lack real communication. And I think that makes a lot of people feel like super anxious and depressed.
Yeah.
And that's like social media. There's like a beauty in social media, but also people not like, it's those little moments like when you're walking down the street, when you connect with someone, that like for me feeds me.
Okay, I honestly like I want to like keep it positive and stuff, but my eyes are swollen. I was crying all day today. Like I was very upset. Like I'm just very upset. Social media is depressing, and it's like, but it's also obviously we have the good part of social media, like this.
Absolutely.
I'm not gonna get off topic though. I don't want to.
Well, I know for women like with mental, like who struggle with mental health stuff, when you do have your period or hormones, it plays a giant role. So it's always good to track that kind of stuff. I realize tracking my period makes me able to go like, oh, this is like a temporary thing.
I'm 4 days away. That's why I'm 4 days away. It's like when I'm 4 days away from my period, like I really can't like deal with someone being like, did you gain 10 pounds? You're the worst thing on the show. Like I'm like,
oh, well, you're
like
that's a no-no.
Wait, what's a no-no?
Like reading comments, or like, I know it's probably impossible not to, but I think in those days you should really try to just shut down the social media phone. It's probably hard to. It's probably addicting because we're kind of masochists, all of us too.
Yeah, totally. Like, what's everyone saying about me? Oh, they hate me. I'm the worst person in the world.
Totally. It's a lot of stories also, like, and I was talking to a lot of friends recently of like what's bothering them. And a lot of it is like stories they're making up, that they haven't actually reality checked and found out if that was actually going on. And I know I do that during times when I feel very depressed. I have like stories about what people are thinking. And that is like, that's when I'm depressed. I find that.
Wrote that they lost their sister to suicide, and it like made me so sad.
Yeah, I mean,
Losing
that's also another thing we're dealing with right now with like COVID and lock and mental health, being that there's also like this taboo of speaking about it and normalizing it. And like, I do think more people, it's hard to talk about, but I'm almost like the opposite, where like I overshare, and then sometimes I do feel like overexposed. But I think it's, for me, it's healthier. I have to talk about it, or I have to be like honest, like, oh yeah, I need my Lexapro prescription, blah, 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 blah. Like, if I try to hide it, I really can't. That's just not who I am.
well, if you
But I know people have jobs, and I know people have different, like, people that are, we have a mother who's a therapist, so it's
right.
more about talking about stuff like that.
Absolutely. If you guys watched the show, you saw last season, I had a little thing where it was talked about that I had bipolar disorder because I had written about it years ago. And not that I was hiding it, but, you know, wasn't expecting to talk about it like on like national television just yet. I was kind of figuring out how to, navigate being on TV. Ramona had, kind of said that, well, Leah has bipolar disorder. And then I had to talk about it. And in hindsight, like, now that we're through it, I was very happy to talk about it and to use the platform to talk about it. I think, just to talk a little bit about bipolar disorder, and it's actually bipolar 2, which I was diagnosed with. And I was diagnosed with that on my 30th birthday. Like, actually, like August 27th, whatever that year was that I turned 30. And it was like a really long, like many years of like medication adjustments. And, you were well aware, you were there the whole time when all of this was going on. A visit to a mental hospital for 5 days. And this is me totally sober. Also, I was sober during this time.
Right.
I actually have never really talked about this publicly, but going to this psychiatric unit this was in 2016, which people are like, why didn't you vote in 2016? I'm like, I got out of the mental hospital a few days before the election. Do you think I was thinking about that? So going there, it actually was like kind of empowering, or like it gave me a different perspective, because of course, like there are some things that
Such a range.
some kind of mental illnesses, like, schizophrenia and things like this, and bipolar disorder, which I'm not even sure I have anymore, like, because I haven't experienced any hypomanic episodes or depressive episodes really since this mental hospital visit. I had some kind of like, and again, this is only my experience. This doesn't mean that anyone should go off of medication or do anything like this. But I was taken off of some of the very heavy duty medications I was on. And I also, which was helpful actually for me, and I realized in that hospital that I didn't suffer from not being able to tell delusion from reality, which is like very serious and like very heartbreaking and, and hard to manage. But I was also, and this is just me, I was creating and putting myself in very stressful situations, in terrible relationships, with whatever, that was making me also not helping my bipolar 2 disorder, right? I'm putting quotes because I don't even know if I have it anymore. I realized like, hey, I'm going to have to, if I want to feel better, I'm going to have to take some
positive, like, behavioral act.
And it's going to take work. Like, I'm going to have to go jogging outside. I'm going to have to make sure I go to sleep. I'm going to have to say no to the hot, toxic.
Totally. Like a self-care routine, and like is really a giant help when you suffer from mental health disorders or issues or personality disorder. But it is also one of the most hardest things to do, because it's so simple, some of the stuff. And I know for me personally, like I can't just rely on my medication.
Yeah.
I have to rely on like a support system of like sleep hygiene for me is terrible. I'm like can be an insomniac. Also getting caught up in labels. I had a doctor that doesn't label, and I've been diagnosed bipolar 2 or borderline or, you know, PTSD, all of these things. And I think your doctor is obviously someone you should listen to, but I also think people should not get so caught up, because for a while I would get so caught up in the diagnosis, I would try to almost become it. Personally, that was my, you know, in my 20s, I'd be Googling it. I'd be like, oh, I have that, because sometimes it's easier to like relate or to be like, I'm broken. And now for me personally, it's like solution. Like what's label? And everyone's mental health changes throughout your life in a lot of ways. And that's not always talking about serious, grave, like mental disorders, you know, but for
and then the addiction aspect of it, right? Like, and
well, addiction, I believe, is mental health disorder, but a lot of people with addiction or alcoholism don't.
But it is, because it's like, whatever, we can.
It's an impulsive, it's a person behavior that you can't control. So
Yeah,
it's
like once I have like one drink, like I have no control over my brain wanting more. Like literally, like even though part of me is like, I really should not have another one. I'm gonna be doing something terrible. Like I can't help it. But also like addicts and alcoholics, whatever, a lot of the bipolar 2 cluster, and when Dr. Rogers is coming in at some point in a few minutes, and we can talk to him about this, because I actually have a lot of questions. But you know, the cluster of like personality traits for someone who has bipolar 2, the hypomania part is also could be someone that has not learned coping mechanisms. Okay, for instance, overspending. Okay, hypersexuality, which
overeating,
not hypomanic. I mean, like undereating, staying up, having a lot of energy. You know, it's much different than the bipolar 1, which is like when you're manic, you're like thinking you're Jesus, and you know,
you don't maybe understand like what's reality and what's not. I feel like I've been on the cusp of
drinking water in our
mason jars.
Why is that? Because it's nice and big, so you're gonna
it's a lot of like water is also important when you take medication. I need those fluids. Exercise, but also someone like have a cup of chamomile tea for sleep. I'm like, bitch, you do not know my brain chemistry. Chamomile tea, that's not going to help me. Like
mom says that. Mom's like, warm some milk. I'm like, Mom.
Yeah, I'm beyond the warm milk and the chamomile state.
Beta blockers. And again, I'm not here to tell anyone to go take beta, you know, that means talk to your doctor.
Very important. Because I also find this is that a lot of people have a lot of opinions about medications, and just because the medication works for them, I really think that people should stay out of other people's medication and not be like, oh, you should get off of that. That's not good. Or you should do this. And I've dealt with that a lot this year, personally.
Don't look at me.
No, with family members' concerns with my medication or this, and sometimes you have to block out that noise, because I have my own medication shame, and I'll be like, yeah, maybe I should try to get off of this, and really talk to your doctor. We all have our own experiences, but like, do not listen to, you know, friends or family just because they're like, well, look, I know you, get off. You don't need that. This is certain, you know, like talk to your doctor, but also it's always good to have like what are you laughing at?
Do you guys have the same disorder?
Probably. I think you're better than me. I don't know.
No, I think like you're
going functioning than I am.
No, you're going more through like you're also dealing with like postpartum stuff and like new mom stuff, which I like when my daughter was 2. Your daughter's 2 right now. When my daughter was 2, I was getting sober. I was having like I had to get so medicated because I was having panic attacks around the clock. And I'm so much better in terms of mental health. Like I really like after that, I went to the mental hospital. Shout out Gracie Square. After I was there,
living life in the mental hospital for a while.
ever had a depressive episode again that lasted more than a couple days, which isn't a depressive episode, I used to like get them really, really badly.
I like interviewed a psychiatrist recently, and right away when I was talking to him, I realized for me, he was not a good fit. And that's also okay, because I've had enough experience with doctors, and I had a doctor that was new and he was young, and I could tell that he wanted to make me his guinea pig. And I had medication that's working, and it's like, why? And sometimes I'm tempted, you know, my addict self, my alcoholic self, I have a doctor like, you know what, we're going to try a new thing. And I was like, just shut that down. I needed someone who was just understanding of my meds are working right now. And in the future, once I get to know you, maybe there'll be adjustments, but right now is not the time to adjust.
Oh, if this was like 5 years ago, or, you know, someone was like, I want you to try this, and that. Yeah. Like, yes, now you could not, like, there is a time and a place when you have to take medication, and I'm on medication. I'm probably going to be on it forever. But yeah, you also have to advocate for yourself and be like, you know what? I actually don't. And sometimes that can be real. Why don't we try this first? And then I can say it again.
Say it again. Oh no, I was just saying sometimes it's hard to advocate for yourself when you have it doesn't give you mutual respect and identifies you as a patient or sick. And I think that is a warning sign of a doctor that's not a right fit for you. Like, also knowing my rights. At first I didn't know that I could say, hey, I'm not comfortable trying that. I want to try this first. Before, if a doctor told me, I thought he was God. And now I have to respect my doctor in order to trust him to know how to, you know, the medication. And if I feel like there's not a mutual respect, like that one doctor, goodbye, last week. Goodbye.
I mean, I had one psychiatrist be like, psychiatry is the wild, wild west. Everything.
Yeah. And it's like, absolutely. And I do love that, like, my last psychiatrist was not into labels, and we worked on like behavioral stuff, and like the only thing he did diagnose me with was ADHD.
Wait, you mean my psychiatrist that you started?
Okay, really have like this. Anyway, he's not my psychiatrist any longer. We shared a psychiatrist. I wouldn't recommend siblings doing that, especially one that's super territorial over her psychiatrist. I don't just see as more of his client, because I did see him regularly, but that's fine. I had to fire him because my family got a little overly involved.
Okay, let's save it for the show. We'll talk about it, like, save it for when the cameras are rolling. Okay. Fitness, sleep,
eating.
What?
For me, eating.
Eating?
Yeah, because sometimes when I'm under a lot of stress, I undereat. And I feel so much better when I make sure that I eat, even if it's like I'm not hungry. Smoothies, getting like the nutrients, because it can make you go off. I feel like.
You remember how thin I used to be years ago? Like, that was my most miserable time. Like, because I couldn't eat. Like, I was so like, I don't know,
some people are emotional undereaters and some people are emotional overeaters.
Yeah, that's true. Is Dr. Roger trying to log in at all? Is he trying to?
Don't try to log in. I can try to.
Are you sure he didn't try to join in?
Well, hold on. Let me see. Dr. Roger. Oh wait, I just sent him a request. Let me see if it's out.
Oh, there's Dr. Jesse Gold, who did a great article in Forbes magazine or website about my bipolar stuff and the show and everything. Shout out to her for writing that. That was awesome. That was like really rough.
Me now?
Hi.
Hi. Hi. Nice to
love talking to their psychiatrist. I'm so glad we have you all to ourselves.
Well, it's great to be on with you. I've been actually listening to your discussion. It's been really fascinating.
What can you diagnose us with something? What's wrong with us? Help us.
Yeah, help us.
Well, I don't know any of that to be sure anything's wrong with you, but I can say this is that, you know, I was listening to what you both had to say, and I thought, you know, what really kind of grabs me is how important it is as psychiatrists for us to really like listen to what patients have to say and really, you know, take their truth as the most important truth in the narrative. In other words, we so often what happens in psychiatry, I see this too often, we try to fit people into buckets, give people labels. And frankly, we get all restless and worked up and agitated when people don't fit neatly into our labels and buckets. And what you guys have been really, I think, hammering home for me is the fact that at best is contrived, and at worst, I think it really dismisses what people are experiencing.
Totally. I might need your number.
Preach.
I'm looking for a new psychiatrist.
He's not. Stop, Sarah. You already stole my other psychiatrist.
Well, you know, in order to see me, I'm up here in Toronto. You have to be able to, you know,
Oh boy.
put on some warm clothes.
Fight over
Oh, I heard a little Canadian accent, eh? I heard a little of that. Okay, Dr. Rogers, I do have a serious question because I've honestly never even asked any doctor this. So back in my early 30s, okay, I did experience the bipolar 2 episodes of like not sleeping, hypersexuality, overspending, and then like I would crash and be so depressed and text my psychiatrist. I didn't even think things were wrong when the hypomania was happening. Why hasn't that happened to me now in several years? Am I cured?
Well, you know, I would love to say that we could cure bipolar disorder, but I gotta then say we can't right now. But here's what I can say, which I think is really important for everyone to hear this. Bipolar disorder is a condition that typically affects people before they're 25. In fact, what I always say is 75-25. So 75% of people, the illness starts to show itself before you're 25. So 75-25. And bipolar 2 disorder, yeah, you know, by definition, it's a mood disorder, like bipolar 1 disorder. And just so everyone listening understands, the difference is subtle but important. Bipolar 1 is mania, and bipolar 2 is hypomania. So it's not quite as severe, but it can still be problematic. And you know what you just mentioned is what I've heard from, I've met tens and tens of thousands of people. I've spent the last 25 years of my life providing care for people with bipolar disorder. That's all I do, is help people with depression and bipolar disorder. And what everyone tells me is that, you know, those hypomanias, those manias, they used to happen more frequently or at least more, you know, sporadically. Now they don't happen very often at all. And depression is what people are more susceptible to. So bipolar disorders affect about maybe 1 to 2% of our population, maybe 3%. But what's interesting is that it's the depressions and those hypomanias you described, those symptoms that you described, those become less common across time.
Oh, well, that kind of answers.
Yeah.
I still have bipolar 2 disorder.
Yeah, and you know the thing. Here's the thing about bipolar, which I've seen. This has been described, you know, in the science around this, is that it kind of changes its presentation. So it may look this way when you're 18, that way when you're 25, that way when you're 40, and so on and so on. It kind of changes. It doesn't have a one-size-fits-all presentation. The other thing is, a lot of people say to me, "How come, you know, my mom has bipolar, or I saw bipolar depicted in a Hollywood movie? That's not what I got." And I think that what people really got to understand is that bipolar disorder is not a disorder. It's disorders, plural. Lots of different types. So, and everyone's affected very differently.
That makes sense.
Does make sense.
And also, I guess I would have a question in terms of like, you work technically with bipolar and depression and mania.
Yeah.
And I'm sure you've seen a lot of like, there was a time where people were getting really left and right diagnosed, like borderline, bipolar 2, being kind of thrown out there because it's easy to fit that box.
Yeah, you bet.
Like, suggest when someone goes to a psychiatrist, you know, and they feel not aligned, or they feel like the psychiatrist isn't hearing, and it's just like, what are some, or what's like some red flags for also people looking for doctors?
You know, that's really a great question. And, you know, let me just say a couple of words with the first part first, and that is that, you know, the diagnoses. And here's a statistic. Here's something I want everyone to be aware of, is that the data show that if you do have bipolar disorder, it can often take many, many years seeing many different healthcare providers before that diagnosis is arrived at. And there's a whole bunch of reasons why that's the case. The other thing is that many, many people come to me who have bipolar disorder and say, you know, I'm hearing from you I got bipolar disorder. And I agree with that. I said, yeah. And they said, I was diagnosed with ADHD, depression, borderline personality disorder, drug abuse, alcohol abuse, OCD, PTSD. I said, yeah, that's quite common. People get all these different diagnoses. And I tell you what that's a result of. I have never met any healthcare provider in my life who takes a lot of pride in giving people a bunch of diagnoses. But the problem we have, and this is just the challenge of psychiatry, is when you look at the DSM, you know, that manual we make diagnoses, it's like a bunch of like recipes. And there's a lot of overlap in the ingredients of all the different diagnoses. And so it gets confusing. So if someone has, let's say, an unstable mood, people say, that's got a lot to do with bipolar, doesn't it? Yeah, but it also has a lot to do with borderline personality and ADHD and so on and so on. So that's why these things happen. And frankly, it's tough. It's sometimes tough to sort it out. And sometimes people can have both. You can have both, right? So it can get tough, but I have to say, I always say this when I'm talking about bipolar disorder. I think the biggest challenge that we have today in bipolar disorder is to get that diagnosis right and get it right in a timely fashion. So what you guys are describing is really important. Here's the other part, and that is that I hear so much gloom and doom out there. You know, I hear all the gloom and doom. Obviously, COVID-19 has been horrible, but put that aside for a moment. Gloom and doom seems to be like, it's just like gloom, doom, gloom, doom, gloom, doom. I don't know where people are coming from. I've provided care for more people with bipolar disorder than I know. And I got to say, yes, I don't want to make it sound like it's all rosy. It's not. But most people do pretty good. They just got to get the right treatment. Easier said than done. But you got to work with your doctor, your nurse, your care provider. And I've seen lots of great outcomes. I've done this a long time. I've seen so many cool outcomes. But people just got to stay with the game plan and find somebody you like working with and just keep trying.
And sometimes your mental health actually, or disorders or labels can be kind of your superpower in a lot of ways.
You know, absolutely. You know, just about a few days ago, I was telling someone, you know what COVID does really bad for all of us? It takes our sense of control away, right? Like people don't feel they're in control of their life with this COVID situation. And a lot of people feel pretty helpless and pretty blah. Of course, this new word, languishing, everyone's talking about languishing. And I think to take that sort of over to bipolar, I think a lot of people with me who seem to say what they don't like about bipolar, they don't feel like they're in control. But with treatment, talking to a good counselor, good therapist, be on the right medication, you will definitely get that control back. And then that sets in motion a more like kind of virtuous cycle.
Okay. Do you find that it's more females diagnosed with bipolar 2 disorder and bipolar disorder? Is it possible that, because we have so many more hormones than men and we deal with a totally different set of hormones, that it is somehow interconnected? I truly believe that. I don't believe that there's been enough studies about PMDD and, you know, PMS, like that it could somehow possibly be connected. Because
men also have an ability to hide their emotions or their, like how they're really doing, which I don't know if that might add to people not seeking help.
Someone just wrote that. That's true.
Yeah, men to be more psycho to me, but not treated. No, I'm kidding.
I'm just trying to blame things on my hormones.
No, hormones are totally a real thing, though.
Yeah.
Yeah, you know, I tell you, here's what I really wish. What I really wish is that 1 + 1 does equal 2. It's nice and simple. I really wish I could sit here, and say, yes, bipolar is because of hormones. I wish I could say. I can't say that. It's not that simple. But here's
added.
Definitely, it can. And here's some really interesting points. So bipolar 1 disorder, the mania and depression, that affects women and men at the same rate. But bipolar 2 disorder affects women about twice as common as the guys. So it is more common in the girls. And we already know that depression, not bipolar, just depression, is more common in women, considerably more common in women. Now, you're absolutely right. Here's an interesting factoid. When women who have bipolar disorder, bipolar 1, bipolar 2, when they first start to have bipolar symptoms, it very often, not always, but it very often starts around the time of the menstrual cycle, or when they start in teenage years, or around pregnancy, or postpartum, I always tell family doctors and nurses, if you see any woman with depression during pregnancy or postpartum, it doesn't mean she has bipolar, but we got to be real suspicious because the sex hormones seem to do something. They seem to kind of, well, the word we use is unmask it. It seems to sort of unmask it. And we're not sure what it is. If a women who are, I've seen a lot of women during menopause, and during that transitional time of menopause, they were stable for years, 20 years, 10 years. They go menopausal, get menopausal, and then the bipolar starts to decompensate. So there is something going on there for sure.
Hopefully I'm not filming still by that point, or shows me.
I have the last question. What do you think is a reasonable amount of time, like, addicts, alcoholics, they go into treatment, they get assessed by psychiatrists, and now they're coming off of drugs and alcohol and a really crazy lifestyle. And why are psychiatrists and these treatment centers so quick to put a diagnosis and get them on medication without even giving them a month of rest and letting them see what symptoms come out? Because it does feel dangerous. I've been in that situation before, so I'm curious.
It's a great question. And I think we got two problems. First, we don't get people diagnosed fast enough. And two, we diagnose it too fast in some people. You know what I mean? And I'm not contradicting myself. I see both situations. And I think, look, if someone's had a pretty, difficult time, it's been a chaotic time, lots of booze and drugs, rock and roll, and so on. It's difficult to know. And a lot of times in those cases, what I'll do, I'll just put a little pause. Let's just kind of clean the booze and drugs out, maybe for at least a month, 2 months at least. And then let's kind of, we think, we'll watch and wait, see what's there, and just be kind of, more, observing. And then we might make the diagnosis of bipolar, say, a month or two later. But sometimes, again, everyone's different. Sometimes everyone's different. I meet a lot of people who come to me smoking drugs, using crack, ecstasy, drinking every day. Just drugs. And I can make the diagnosis of bipolar. People say, well, how can you do that? Well, I take a good history. It turns out that when they were like 15, they had a lot of depression. They had a lot of anxiety. They had hypomanic episodes that nobody noticed. They got a family history of mental illness. And only around, let's say, age 22, they started abusing drugs and alcohol. So in that context, taking kind of a panoramic view of their life, you can kind of fill in the picture. But if you don't have that panoramic view, I agree with you. You should not make, careless diagnoses just simply based on a quick visit, in the emergency room or something like that.
Insurance, to tick the insurance boxes. That's a part of it.
Right.
In America, the treatment, that's how they're getting billed and paid and all that stuff. It's a very good thing, all of this stuff, treatment, healthcare. And then on top of it, if you can't self-pay and you're going through insurance, you have to get these labels for the treatment and doctor paid, which is understandable. But then it can be sorted.
Yeah, you hit the nail on the head. That's a big problem. I meet nurses and doctors and physician assistants all over the country. I spend most of my time in the U.S., and they are really upset with that they don't get more time to spend with patients, but they've got some boss wearing a shirt and tie who's like emailing them saying, you got to hurry up, you got to only spend 10, 15 minutes with the patient. We got to get so many patients through the system. I always call that the Chipotle model, making burritos. I don't think we should we should be running a clinic like burritos, like Chipotle. I mean, why don't you spend some time with people? So this is, everyone I talk to across the country who's a healthcare provider is really upset with that. They do not like that. That's not why they signed up to be a healthcare provider.
Absolutely.
They don't like it.
That makes sense. And the doctor struggling on the other side, which is a good thing to know, to empathize with that.
Yeah, totally. Absolutely. It's true. It's really true. And, I mean, look, let's face it, we're all time poor. Everyone's running, everyone's got short on time. But this is something we got to get right. And, the way I look at it is it's like anything else in medicine. You got to take the appropriate time to get that diagnosis right. Because some might say to me, oh, what's the big deal? Aren't all the drugs the same? Isn't the therapy all the same? Well, there's a lot of similarities, but there are some important differences, and I think it does matter to try and do your best to make that diagnosis. Here's one other point. I'm going to blame Mother Nature for this one. I see this all the time. You see, bipolar disorder, people have mania or hypomania, but they also have depression. Depression is more common. But here's the part that really is tricky. Depression is usually the first way the illness presents itself. And for a lot of people, when they're depressed, they go to their care provider. They never had mania or hypomania, so nobody knows they have bipolar disorder except Mother Nature. And then the bipolar shows itself 3 years, 5 years, 7 years later. And one of the observations about psychiatry is what you guys would probably even know this. Once you get a label, it sticks. I mean, it sticks. And so if you've got a label in your chart of depression or borderline or alcohol abuser, it just sticks with you like a tattoo for the rest of your life. And so what happens is it biases people. And so what happens is I'll see a lot of folks 3, 5, 10 years later, they start having hypomanic symptoms that are obviously bipolar. And then the person saying, well, yeah, but I thought they were depressed. So they get biased. They get kind of locked in that mindset. You know what I mean?
Oh, wow. I love talking about this.
No.
Wait, why aren't we have to do this more, Sarah? And we have to talk to Dr. Rogers some more.
So informative.
He's amazing.
No, he's confirmed some of my suspicions.
Sarah, you are you really have such a deep knowledge of all of this because we're kind of working at a place. And
yeah. Also, I've been on both sides of helping and also having mental. So nothing's worse for me than going to a doctor that I feel is a textbook doctor that has never experienced it. And this is also very biased, but I feel like the lack of being able to empathize or really know the lows that I'm feeling, or when I was in treatment, I would always ask my counselor, are you an addict or an alcoholic? Because if not, I don't want to hear you just ramble off about alcohol addiction that you read, and now there can be great doctors, I'm sure, and great therapists that aren't out, but for me personally, I have a hard time with that. I'm like, no, I need switch, but sometimes they don't let you switch, and that is a good thing too.
Right. Yeah.
All right. Well, I think we're gonna wrap this up. I do have to.
Oh, I'm so sad.
No. I have to go meet Ramona for dinner because obviously we have made up since she outed me for bipolar, and
Well, it's good.
We gotta let bygones be bygones. Laugh about things sometimes. Dr. Rogers, you are basically the Mr. Rogers of psychiatry. You are an absolute gem. Thank you for talking to us. Thank you for joining us. Sarah, I love you so much.
I love you.
And a lot of fun. Great to chat. Let's do it again.
Yes, absolutely. Thank you so much.
Hey guys. Be well.